It's definitely a nationwide problem. We're consuming 99% of the oxycodone in the world, and we're 5% of the world's population.
Many call it an epidemic. Prescription drug addiction is growing drastically. Now the federal government is trying to stop the problem. Commonly prescribed painkillers are the drugs abused the most: Vicodin, Norcos, and other types of hydrocodone-containing medications.
The U.S. Drug Enforcement Administration recently tightened regulations on how these drugs are prescribed to curb abuse. In this special report, 9 and 10's Samantha Radecki shows us the rules are causing headaches for some patients and doctors.
It is the #1 prescribed drug in the U.S. on 130 million prescriptions a year.
Hydrocodone is a potent drug commonly used to manage pain. Vicodin is typically prescribed after wisdom teeth are removed, when you have knee surgery, or for chronic back pain. It's effective, but there's a catch.
Opiate medications in general have some sort of euphoric feeling that allow patients to be emotionally and physically addicted to it.
For that reason, the federal and state governments are tracking the abuse.
I think it's being used a little bit too much, and I think it's being abused. So it's definitely something that from all sides we need to look at this and say, okay, is there a legitimate need for this patient to have it?
Last fall, the DEA tightened distribution regulations on hydrocodone medications. They are now considered Schedule II narcotics, up from Schedule III. That means tighter government control.
At this point, the federal government is saying there is a legitimate medical use for it. We see the use, but we also see the potential for abuse, and that's why we're making it a higher schedule.
This change requires chronic pain patients to see their doctors each month to get a written prescription. Doctors can no longer write refills. They can only prescribe a 1-month supply and then 2 more months with scheduled dates. After that, they have to visit the doctor again if they need more.
What Schedule II does is it makes it difficult for a large amount of medicine to be prescribed at one time. We're not allowed to write for a 90-day supply. We need a face-to-face, or they have to come in and physically pick up a prescription.
Some patients and doctors say it's a hassle.
It's a problem for both, because now the patient has to come in every month instead of once every 3 months. And it's a problem for the provider, who's already overbooked with patient loads, already super busy, and now their patients that they saw once every 3 months now has to come in once a month.
Although these heightened regulations can make some more work for the pharmacists, the doctors, and the patients, many agree that they can be habit-forming, and they should be more controlled.
Anything that closely supervises opiate prescriptions, I think, is a good idea. But anything that then inconveniences the patient or inconveniences the provider, I don't think is a good idea. So it's kind of a double-edged sword there.
One hydrocodone patient in Mecosta County who doesn't want to be identified says he thinks more needs to be done.
You got to set up a separate appointment just to get the medication. And usually I used to just call them in. Now you just got to go and hand deliver the script. That still doesn't protect you from getting robbed.
Yeah.
And this place has been broke into so many times, it's unreal.
The drugs are so in demand on the streets that his home was broken into earlier this month. He says 2 armed men were trying to steal his hydrocodone medications.
Just to rob me, take my pills and money. It's been a problem around this area.
I don't think it's any coincidence that this law came to effect. And in northern Michigan, we've had a great number of pharmacy breaking and enterings, where people are breaking in and stealing these drugs from the pharmacies. So these people are clearly, they want these drugs, and they're going to find a way to get them.
Doctors say they do all they can to check patient histories and prescribe carefully, but it's on the patients as well. Many addicts will try to doctor shop, which raises many red flags for physicians.
It's worrisome that they're addicted. It's worrisome that they're doing something illegal with them, potentially selling them.
It remains to be seen if the new rule will do anything to curb addiction to painkillers.
It'll take a while to find out after you collect some data to see if it truly is helping.
Its idea is good. They did this to Oxycontin years back, and they found that younger teenagers were less apt to abuse this, so this just helps make sure legitimate users get it and keep it out of the hand of the people who are diverting it to another source.
Reporting for 9 and 10 News at 6, I'm Samantha Radecki.
And you can dispose of any unused prescriptions at safe drop locations at many police departments and pharmacies.